All right, and with that in mind, let's talk more about COVID concerns in the wake of this storm. We are joined now by Dr. Catherine Choisi with UT Health. Good to see you. Thank you, Doctor, for joining us here on Digital this morning. A lot of people watching and have some questions for you, including, let's talk about the setbacks with vaccine and testing because the storm closed some of those areas where people could go.
Yeah, unfortunately, as you said, because of the weather, the people who are doing vaccinations and testing couldn't continue, which puts us back a week or so. And also means that the data we're collecting, we don't have a good insight into what happened this week because the reporting, testing being done and the reporting just wasn't happening.
What about people who have to get their second doses? If they were set to get it this week, does that mess up or are they still okay with getting it later?
They've been rescheduled for a week later, which is within the time frame. So they should that it's okay to get that second dose. So they should be fine.
Okay, and then what about rescheduling of appointments? What are you suggesting people do? Are they waiting for text messages? Is this going to be an email kind of thing? How is this organized?
Yeah, I think it depends on the provider. I'm sure they're overwhelmed right now. You might wait a day or two, see if you hear, and then try contacting them.
So do you think that the sites where they were doing all of the shots and also the testing should be back to normal by this weekend possibly?
Yeah, maybe even today.
Oh, that would be amazing because we had a very long week. So to recover that quickly is really good news to hear. Now, the other thing that I want to ask you about, of course, with all the other issues, they took precedent over social distancing a lot this week. A lot of people didn't have masks on and they were dealing with other things, unfortunately. Do you anticipate a surge in cases after this week in weather?
You're absolutely right that the cold and lack of heat, the lack of water took precedence over being concerned about COVID. And so because people may be staying at other people's houses in congregate setting, gone to warming centers, it's entirely possible we will see I hate to say surge, it may not be that bad, but an increase in cases over the next couple of weeks.
All right, any other information that you think might be valuable to our viewers right now that you'd like to tell us about?
No, just remember we're still in the midst of a pandemic, so take what precautions you can. Wear your mask, social distance if you can.
Okay, yeah, I mean, we go back to the basic advice. Okay, Dr. Choisi, thank you so much. And I think your little dog is in your lap. Hi, doggy.
No, this is my kitty. Mo.
I can't tell. Yeah. I just saw little ears. I'm like, is that a terrier? I don't know. It's a big cat.
It's a very big cat.
Warm. Doctor, all right, thank you. We'll see you in a little bit.